Side effects of scoliosis surgery. Very often when I consult with patients, they ask me a lot of questions regarding scoliosis surgery. And scoliosis surgery can be described as something called spinal fusion in the greatest form. Meaning spinal fusion typically in somebody with a low back problem or a cervical problem may fuse one or two bones in that area. But spinal fusion in a scoliosis patient is normally fusing multiple vertebrae, 4, 5, 6, 7, 8, 9, 10, 11, 12 different vertebrae. And it's normally fusing the most tilted vertebra above the apex of curve to the most tilted vertebra below the curve. Now, if you have two curves, it may expand both curves, and it's fusing them into one solid bone. And it's using rods and screws to hold the spine in place when the doctor puts bone grafts into the spine to help hold that spine, or the bone grafts will actually fuse and form one solid bone. The goal of scoliosis surgery is very simply to stop progression. That's the number one goal. Results are really never guaranteed in terms of reduction, but in most cases they are reducing the size of curvature because they're making the spine straighter as they're putting these rods and screws into place and they're applying these bone grafts. This is done by fusing the most tilted vertebra above and below the apex into one solid area. The reason why they want to stop this progression is because we know scoliosis is progressive, meaning scoliosis progresses and it worsens over time. The most rapid phase of progression is typically that occurs in the adolescent stage when patients go through this growth stage. However, it doesn't completely stop at this once the patient has stopped growing. As they go into the adult stage, curves progress, but they progress much slower as a result of gravity, and it's normally dependent on the size of curve. So meaning the smaller your curve is in this growth stage, the better off or the slower your progression will be in the adult stage. We also know in adolescence that as your curve becomes bigger, it's more likely to progress faster as you go through your growth stage. So even though we know bigger curves are more likely to progress in the adult and the adolescent stage, unfortunately, most of the treatment options that are done in the traditional approach don't always take this one factor into consideration. Scoliosis is not curable, no matter what method you use, whether you use surgery, whether you use conservative treatment. It's not treatable. It's not curable, but it's definitely treatable. And for conservative treatment to be successful, the smaller the curve is, the younger the patient is, the better the chance conservative treatment can respond. So one facet of scoliosis treatment alone is, number one, is stop progression, either in the adult form or in the adolescent form. In these two different treatment options, meaning traditional versus conservative approaches, you have to really choose between which way you want to try to manage your scoliosis. Traditional approaches typically funnels patients towards this surgical option where there's spinal fusion that's happening, where conservative approaches or more proactive approaches that are trying to focus on non-surgical treatment options to prevent a curve from becoming severe enough where there's the risk or the decision that a patient needs treatment. In this traditional approach, as patients are pretty much told in the majority of cases just to watch and wait until a curve becomes severe enough to where surgery becomes now an option, where it hits the severe category. There's only one time in the whole patient's life of scoliosis that it's considered treatable in the in the traditional approach. And that is while you're going through the growth spurt in this adolescent stage, somewhere between 10 and 14 years of age, and your curve is between 25 and 40 degrees. If you're in that 15-degree window and you're going through rapid growth, they may recommend a Boston brace to try to slow the progression. Every other case outside of that, in terms of trying to reduce the size of the curve, there's no treatment option. They may help you with pain. They may give you treatment options for pain. They may do some things like those things in those lines, but nothing to actually reduce the curve. In the conservative model, we're actively trying to reduce curves before they get to the severe stage, so therefore you don't have to consider that as an option. And the reason why, because there are risks associated with surgery. The risks are the reason why they have to wait for a curve to become severe enough before they can do it. If surgery didn't have inherent risks, they would do surgery much sooner in patients, much in smaller curves. But they have to wait for curves to become 40, 45, 50 degrees or greater to even consider surgery because of the risks associated with it. Of course, there's definitely a risk of SX blood loss. There's risk of nerve damage occurring while they're inserting the screws and the rods. There's always a risk of infection in any type of surgery that you have. And of course, there's always a risk of pain at the fusion site. Some other potential risks that are going to happen post-surgically is going to be loss of spinal flexibility and range of motion. This is definitely a result of spinal fusion. It's actually what they're doing is they're fusing the spine. So yes, they may make your spine straighter, but you're removing the function of the spine. By definition, spinal fusion is a non-functional approach. It's kind of like getting your arm and getting your elbow and saying, okay, you have an arm problem and your elbow is supposed to move, and let's just fuse your arm to completely together. Your elbow joint no longer moves, and yes, you have a straight arm, but it has no function. The function that it was supposed to do is now eliminated, and that's a non-functional approach. You wouldn't say somebody necessarily has a healthier arm because it's fused. It's just fused. So therefore, it's a non-functional approach. You can end up having an adverse reaction to the hardware itself, meaning an allergic reaction or sort of infection in the hardware, which can lead to some problems. It can lead to weakened spinal structures, as sometimes the bone grafts don't take. The only thing that's holding it together is the screws, and that can lead to hardware malfunction or even progression of the scoliosis, or the hardware actually pulling out of the spine, leading to further issues. The spine can be also more vulnerable to injury because it can't accept compressional forces like a normal spine could. And of course, there's a tremendous amount of monetary costs associated with the surgery and the possibility of future surgeries over somebody's life. So there's a tremendous amount of risk associated with a curve progressing into the severe stage. And this is where I think where the conservative treatment option shines, because the worst case in a conservative treatment option, meaning if a curve was going to progress to surgery, then your recommended surgery. Well, the worst case in a conservative treatment option is the curve still progresses and your recommended surgery. But once you have surgery, the worst case could be very bad. I mean, the risks are very highly severe, and they can really affect your quality of life, and it's very difficult turning back. The best case in conservative treatment option, your curve is reduced. You never even consider surgery as an option. The best case of surgery, you still have surgery. You still have rods and screws in your spine you have to deal with your entire life. So therefore, it makes sense that you would try to treat the spine conservatively to try to prevent all the risks associated with scoliosis surgery. Even in the best case scenario with scoliosis surgery, you still have something that you have to deal with that more than likely is going to impair the quality of your spine and the function of your spine. Here at Scoliosis Reduction Center, we offer conservative, non-surgical treatment options that are, number one, less costly, they're much less invasive, and they strive to preserve the spine's normal and natural function so you can live a life unworried about the complications of spinal fusion and rods and bone grafts and screws that could be affecting your spine for the rest of your life. Thanks for watching. I hope you found this information helpful. If you'd like to hear about other topics and information on scoliosis, type in the comments below and let us know. And finally, subscribe and hit the bell icon to be notified of when we publish content. Thanks.